Well, time now for our mental health moment of the week, and there is an effort in the legislature to help prevent future closures of children's residential programs. And here with us to discuss is Sweetser's Chief Program Officer, Kristie Worcester. Kristie, thank you for being here today. And for those who are unfamiliar, what exactly is this level of care?
Yeah, so Sweetser has two child residential programs, one in Saco and one in Winterport. These programs, treat youth 10 to 17 years old. We are actually one of the few providers left with children's residential in the state of Maine. The youth that come to this program traditionally have trauma in their history or other behavioral health challenges. Kids come to our program for about 9 months. They get individual, family, and group treatment. That's overseen by a licensed clinician. There's nursing, med management, and behavioral health professionals there. They often struggle with severe aggression and property destruction, some boundary challenges when they get to us. And by the time they come to this service, generally speaking, they have had contact with crisis, with emergency rooms, sometimes even law enforcement and inpatient facilities. They've tried all other levels of care, like outpatient therapy and home and community-based treatments at this point. Now, Sweetser has closed 16 out of 32 of their beds in the last 2 years, and statewide in recent years, over 100 beds have closed. So the system really is struggling with this program right now.
So it sounds like this is a really important service, so why the closure of the beds?
Yeah, so it is an important program, and there's a couple of reasons that we are struggling, and it's really related to the fact that the Medicaid rates haven't kept up with what it takes to run a 24/7 program. It's also about the inflation that has come to the workforce, and the workforce has traditionally been underpaid anyway. And in addition to that, we're talking about things like utilities, food, insurance, regulatory costs going up as it is. And I think that if we can't get this stabilized, I'm really concerned about being able to continue this service.
So what's the solution?
Yeah, so we see LD 2125 as being one of the solutions, at least in the short term. There are long-term solutions underway, which is exciting. However, the $1 million that for stabilization would really help us to keep this service going, so no beds would be closed at this point. If more beds are closed, all that's going to happen is we're going to end up pushing the problem over to emergency rooms, juvenile justice, and inpatient facilities, and possibly even more out-of-state beds. So we really want to see this, get funded, because once you close a residential bed, it's very hard and costly to get it back open. And our children and families need this service.
And if they're sent out of state, it kind of it makes everything a little bit more difficult to do that treatment. The idea is to keep them closest to home.
Absolutely, absolutely.
Yeah, so how can people help if they're interested?
Yeah, so by contacting their local legislator and asking them to support LD 2125. We are so grateful for the unanimous and bipartisan support of the HHS committee. However, we really need this to pass the supplemental budget. It's very important to us. Otherwise, this program that is in crisis is just going to continue to face more challenges and leave our youth vulnerable and potentially in services that are, not the right levels of care for them.
Right, and far away.
Far away.
Yeah, exactly.
And,
All right, well, Kristie, thank you so much for joining us. A really important topic. We appreciate you coming on the show and raising awareness about this.